Okay, good evening, everybody, and welcome back to the IDF webinar series. Thank you for being here with us this evening. We are recording this webinar and we will be making it available on our website very soon. We will also be taking questions at the end of the presentation, so if you would like to type your questions into the chat area, we will get to you when we get to the Q&A session. You can also use the raise hand feature as well if you would like to ask your question directly. Thank you very much. I will now hand over to Desney Marston at Healthcode, who is the Product and Marketing Liaison, who will introduce today's topic and speaker. Thank you very much, Desney.
Thanks, Gwen, and thanks to IDF for allowing us to host this webinar. I'm joined today by my colleague, Kingsley Hollis, who is the Head of Business Development, ePractice, and he'll kick off the webinar, and I'll just be around to answer any questions and chip in where I see fit. Over to you, Kings.
Thank you very much, Desney. Thank you, Gwen, and the idea. So good evening, everyone, and thanks for joining us. We're just going to run through how Healthcode can help kickstart a private practice or gain ground to an existing private practice that you may have up and running. I'll just move on to the next agenda slide. So as part of that, we'll run through some quick introductions, a little bit about myself and Desney, and a little background about Healthcode. Talk a bit about building the private practice, data security, which is key these days, well, always has been, but is certainly at the forefront. Some of the systems that we have available, so ePractice, the clearing service, PPR, or the private practice register, ICE, which is our new booking system, and then some further considerations that you might want to be taken into account when building up your private practice. And then, as Gwen said, we'll have a Q&A session at the end of the slides as well. So a little bit background about myself, my origin story, if you will. I've always worked in or around private practice, various different roles over the years, kind of starting out customer services, service delivery, then moving more into kind of technical sales roles and business development. And that's always been for practice management systems. So started life out at DGL, which ultimately became Clanwilliam. Spent about 25 years there before joining Healthcode in 2017. So I've just gone past my 7-year mark with Healthcode, concentrating on the ePractice product, but kind of a variety of stuff because all the systems are interoperable.
Thanks, Kings. I'm Desney, as you know. I started at Healthcode a couple of years after Kingsley in early 2019. But before that, I actually worked in the UK's private healthcare sector, probably for nearly 40 years. Gosh, that makes me sound old. And places where I worked included Nuffield hospitals. And my claim to fame there was that I helped set up the very first screening unit for Nuffield way back in the day when Nuffield had 2 central London hospitals. I was then practice manager for private GP clinic practices, firstly in the city and then in Chelsea. And for the last 13 years before joining Healthcode, I was practice manager of an ear, nose and throat clinic in Harley Street. So I do understand things pretty well from a practitioner point of view and from a service provider point of view. Off you go, King.
Thank you, Desney. So Healthcode, just a little bit of background. Healthcode has been around for 24 years now, started in the year 2000. The core of what we do is the invoice claim submission and validation for the industry. An awful lot of what we do is actually kind of mapping. So we create the structures in the background, such as industry standard codes, that no matter which practice management system you're using or hospitals are using, you might have your own service codes. They get mapped to an industry standard code, and then that could be mapped off to an insurance code, or they might accept the industry standard code. So a lot of what we do is creating that structure in the backbone of that within inside to things. Company's been going from strength to strength. Any money we do make gets ploughed back into the company to help us develop new systems, which are always done for the good of private practice as a whole. So we're now up to about 70, 75 staff onshore, based out of the Staines office that I'm sat in at the moment, so not far from Heathrow, with about, same again, in offshore people, mostly in India, working on development of products on that side to it. And this year we're processing about 10 million invoices worth about £4.5 billion for the industry at the moment. It's very much up this year. I think we're estimating about 20%. So private practice is booming at the moment. And so a good time to start a private practice if that's what you're considering. We do all the bill processing for pretty much every private hospital out there. There might be a few kind of PPU, private practice units associated with NHS hospitals that might still be doing it on paper or something like that, but we'll be working with them to move them across to electronic invoicing. Our private practice register is now in excess of 43,000 registrations. So whereas historically you'd have to apply for each insurance company separately to get recognition, we're trying to centralise that process so you have a single store of data and access your profile through that for adjustments. But we'll come on to that more later. And we work with all the main insurers, primarily around the invoicing side of things, so the validation, but also offer additional services like the PPR, etc. But we're always working with new insurers to bring them on with EDI or electronic invoicing as well. So there'll be some news shortly coming out in the industry about additional insurers coming on board with that, which is quite exciting. And again, security we'll talk about more later, but we're both ISO 27001 certified and Cyber Essentials certified. Like I say, security is key to everything that we do. So looking at building a private practice, there's some kind of foundations when looking at a private practice system or practice management system that we'd recommend. Any system should have these. So patient management, essentially you want somewhere to store your patient details in a secure environment, have all the demographics and such at hand. Diary management, so no matter where you're treating out of, having a centralised diary is key so that you've always got an eye on patients that are due to come in. Document management, so there's still an awful lot of paper involved in private practice, both inbound and outbound. So if you've got GP referral letters, etc. coming in, those can generally be scanned in, stored against the patient record. And equally, if you're referring a patient on for perhaps physio or something like that, that can be generated from the system and then sent off by whatever method you choose. Obviously, core to it is the invoicing and payment side. It's very much the core of what we do here at Healthcode. So your systems, you want them to be able to raise invoices, both off to insurance companies or self-funding patients, etc. But equally important, being able to record those payments coming into the system as well, so you know where you are as a business. and then being able to report on all of that information at the end of the year, or keep an eye on that from a cash flow perspective as things progress. What I would say about starting out in private practice is a lot of people try to do it with kind of Word and Excel as a starting point. I'd highly recommend kind of staying away from that and get a practice management system that's a dedicated program to be doing it. This is partly because if you start off with Word and Excel, it'll quickly become unmanageable, and then you'll end up needing to backtrack and populate your practice management system with all of that information. And generally, it's much better to start out with that system and get used to it while you perhaps don't have as many patients coming through the door. Another key point I'd say is secretaries. A good medical secretary is absolute gold dust within the industry. And it may be that if you're not big enough to kind of justify a full-time secretary at the minute, someone might work with you part-time to help bring your practice along. Medical secretaries are very much kind of the window to your private practice, and it makes far more sense for a secretary to be kind of progressing through that admin side of the system rather than yourself, so you can spend that time with the patients and everyone's doing the best to get all of that admin through the system with the least amount of fuss possible. All these practice management systems are here to make your life as easy as possible. That's what they're aiming at. So these systems with multiple users, so both yourself and your secretary can access them at the same time, be looking at the same information, and using it as a single source of truth as your private practice grows and progresses. So ePractice itself, let's say this is our offering from a practice management solution. There's 3 tiers of the software. Essentially, you've got Basic, which is a freemium model. You'll be able to put that in place just by registering. Doesn't carry any cost for the practice management side, but has some limitations on functionality. So it's essentially there so that you can put your patients on, store them with the demographics, etc., and be able to raise invoices off to the insurance companies or direct to the patient if you wanted to. You would need our invoice clearing subscription in the background to transmit off those electronic invoices. There is also now, again, I'll touch on it a bit later, where we've released ICE, the online booking solution for the industry. Currently, that's a free subscription, so you could sign up to that as well, which would then add a diary into the basic version. Slightly limited on the functionality, but would certainly get you up and running. Then we'd progress on to the light version of ePractice. I always consider this more of an accounts system. So it's not quite a fully fledged practice management system, but has some very nice functionality around the invoicing. So things like being able to look up a patient's membership number with an insurer, which is kind of key to getting your invoices across. I think it's saying about 70% of invoices that fail do so because the membership number is missing or incorrect. So just being able to look up that membership number without needing to ring the insurance company and kind of get through to someone to check that kind of information saves a lot of time. There's also other functionality in there, so things like auto-populating invoices. Because we're validating all of the information from the hospitals as well. If you've done surgery, they'll transmit their invoice across. That'll all pass through validation, but part of that information is the controlling specialist. So that then allows us to feed all of that information back to your ePractice system so that you can quickly add the patient on, raise the invoice with all the correct information, and just add the fee that you're charging for your services into it to get that transmitted across to the insurer. Adding the fee can be nice and easy on Light as well, because it's got a pricing matrix system built into the back of that. So you can set your fees once in the background and just click a calculator, and that'll populate the fee into the system. Very nice feature of this is also the remittances. So on the basic tier, you can get your remittances back from several of the insurers and you can view and print them. Whereas with the Light and the Pro system, the system can actually work out which invoice, which patient that relates to, summarize it for you, and just double check the work so that you can then hit a button and that'll automatically mark those payments off on the system as well. Alongside that, there's also an option to sign up for Patient Zone. Patient Zone is effectively electronic invoicing direct to self-funders. So you can raise your invoice, transmit it through Patient Zone. Then if I'm the patient, I can log on, see the invoice, tap in my card details, process the payments, and then that'll automatically update in ePractice as well. That does carry some separate fees because it is an affiliate program, but a very effective way of either invoicing patients directly, or if I've got an excess and you've processed the remittance from the insurer, it could automatically ping the excess payment or invoice off to the patient, so you can mark that off as well. And then you've got ePractice Pro as well, which is more of a fully fledged practice management system. That includes additional features such as patient notes, so you can scan and store notes or documents coming in about the patient. It's got a fully fledged diary in that system. The reporting as well has much more functionality around it to pull additional information out, and all of your correspondence can be generated from that system as well. All of these systems, we don't put a contract in place as such, so there's no annual term. It's just a monthly rolling subscription, and then each month you can decide which tier of the software you wanted. So you could try Light, then move on to Pro, or vice versa as you need to.
And I think the important thing as well to say, Kings, is that it's only per practitioner, not user. So it doesn't matter how many people are actually accessing the system, you'll only pay the fee that was shown on screen.
Indeed, yeah. So the system will grow with your private practice over time without incurring additional costs, such as the users or customer service fees, etc. as well. So ePractice diary-wise, the new iSystem has been integrated with ePractice as well. Again, I'll come back to ICE in a moment, but essentially it's based off of the travel industry global distribution system. So no matter where you go to book your flight, could be Kayak, last minutes, BA directly, etc. In the background, there's a global distribution system that knows all the flight availability, etc. And effectively, we've built that for private practice. And ePractice is the first system that's been integrated. So if an appointment got booked through that system, that can automatically populate into the practice management system. And we're working with other practice management systems as well to see if they'll integrate into the system to make use of that. But I think that's one of the real benefits of having everything in one place with one company. I always think of Healthcode as a bit like an F1 car, if you like. Probably just me, because I'm a big F1 fan. But if you think about something like Mercedes, they're a bit more like Healthcode because it's their engine, plus they also design all of the aerodynamics, all of the steering wheel, driver input, etc. So it's keeping everything in one place. Whereas other practice management systems are using our VADA system, which is essentially the engine in the background that does all of the processing and validation on the invoices. So it's a bit like Williams race car, where they're using the Mercedes engine still. So it's a Healthcode engine in there. But they're designing all of the other inputs that you're putting into the system. So different aerodynamics or different ways of entering patients or using the system through the UI. Some of the other bits that are useful in ePractice, things like it being integrated to the clearing system automatically, patient inquiry that we've talked about, or membership inquiry, auto-populates that we said about. Things like the traffic light system is quite handy on the accounts as well. So where you're raising invoices, transmitting them off to the insurance company, you'll get a green box to say, yeah, that's processed through the system, it's kind of past validation, it's been transmitted off to the insurance company, and then the insurance company receipt that file as well. So you get 3 green boxes. But really handy with that is you can just leave the mouse over that and it'll give you the dates that the insurance company receipted that invoice. So if they're ever saying they can't find the invoice on the system or anything like that, you've got the information to hand to say, well, you've confirmed you've received it. This was the date. Can you inquire the system again to see if that's progressing towards payment, etc. So yeah, clearing service. This is a separate entity to the practice management system, because if you were using a different practice manager, there's probably about 50 of them available in the market these days. You can still put the clearing service in the background, then whichever system you're using, let's say that uses our engine to do all of the validation and transmit that invoice off to the relevant insurance company. Clearing, as it stands, is really effective way when you consider that against kind of paper invoices. It's far cheaper to be able to transmit it from one system off to the insurer. It's also far more effective than kind of going to the insurance company's own websites to repopulate a lot of the same information onto that system to then be able to submit it. Plus it means you can keep everything in one place. So if you're just raising them in ePractice, for example, transmitting them off, you've got that single source of truth to be able to just look up where all the information is, rather than worrying about having to look on a different insurer's website or anything like that. Clearing also brings down the payment cycle as well. So because the bill has been validated, transmitted straight off, we've done all those pre-checks on it, you should get paid a lot quicker from the insurance company, which obviously then improves the cash flow, which is critical, especially well for any practice, but certainly when you're just starting out in private practice.
Just to jump in there again, Kings, I remember my experience, because we first, in my previous role to Healthcode, as I said before, but for those who weren't on at the beginning of the call, I was a practice manager and worked in private healthcare sector for nearly 40 years before joining Healthcode. And I remember when we did first start using the clearing service, it was a sea change almost overnight. Whereas before we used to send an invoice off to the insurance company, we were lucky if we got it paid within, say, a couple of months. I mean, 6 weeks was really quite good. We put the clearing service in, we started sending the invoices, and we started seeing money actually hitting the account, sometimes in as quick as 2 weeks. So it really, really does make a huge difference. And if you're running your practice, you've got staff to pay, you've got expenses, to have that money constantly flowing in is such a benefit to anyone, and it actually stops you stressing over, you know, will I have enough money to pay the rent? Will I have enough money to pay the staff? Will I have enough money to pay the telephone bill? So it's definitely worth thinking if you're not doing it already. Yes, there are costs involved, but the costs are easily negated by the fact that you have a much more efficient process. And of course, all the costs that we're talking about here can be set against your well, they're all legitimate expenses and can be set against your taxes at the end of the year.
Worth it just for the peace of mind, I think.
Yeah, absolutely.
So PPR profile. So those that aren't aware, you can now register with Healthcode for the PPR, private practice register. So rather than having to apply for each insurance company individually, you can literally populate the information into your own PPR profile and then pick and choose which insurers to try and gain recognition from. There are a couple that aren't on this system yet. Again, we're always working with the insurers to try and bring them on board. The notable one being Bupa aren't on the PPR yet, so you would have to deal with them separately. I've kind of stolen this this screenshot here. This is our brand new PPR profile and interface that's just about to be released. So anyone that's already registered is probably thinking, oh, I didn't look quite like that. But this will be hitting production, so our live environment in the coming kind of weeks, maybe months. It's a revamped version just to make it easier to use, a much nicer UI to interface to. But it's really important to kind of keep this information up to date because it's what the insurance companies use as their kind of sole source of information. And really they want up-to-date, accurate information. So they've got the confidence to guide their membership to the relevant person so that they're getting the treatment that they need. Leslie, did you want to touch on ePractice?
Yeah. So I know Kingsley has mentioned about insurer recognition, but it's not just about that. So hopefully you'll all have heard about the Medical Practitioners Assurance Framework, which is commonly known as ePath. And this was issued by the Independent Healthcare Providers Network back in October 2019 and refreshed in September 2022. So although it was the sector's response to recognising that greater consistency was needed around governance and clinical oversight with reference to practicing privileges, it has actually now been accepted by all regulators. So we thought, well, okay, we've got the PPR profile, we've got it there for insurer recognition. So what we will be doing in the future is introducing more features into the profile that align with this framework. So making it more useful to hospitals who currently are already using it to map practitioners working with them for invoicing purposes. So what we're trying to do is make our, as Kingsley alluded to earlier, joining up our systems a lot more for your benefit, for hospitals' benefit, and yes, for insurers' benefit, but everybody works together to create a successful private healthcare in the UK.
I think as well, kind of PPR aside, I was a patient recently. insured by Bupa, they kind of sent through a list of practitioners that I might want to go and see, and only one of them had actually populated their information onto Bupa Finder as well. And ultimately, that's the person I went with. And it wasn't really even that I was looking for a specific bit of information myself. I think just the fact that that information had been populated gave me a bit of reassurance, just because I could find information about the practitioner. So, like I say, PPR-wise, definitely worth making sure that's up to date, registered, but also other places such as Bupa Finder, etc. is definitely worth doing.
And just also on that, another reason for having a profile is if you do intend to use our online booking system, ICE, again, that Kingsley has spoken about, we use the profile to bring that information into the system. So although the public will never see your profile, information from it will be used if somebody's searching for, let's say, an orthopedic surgeon specializing in knees that works 10 minutes from where I live and is available next Tuesday week. So all of that information will be pulled from your practice management system, combined with your PPR profile, spewing that information out to the patient so that they can then make an informed choice and go and see somebody that really does suit their needs and requirements. And of course, the insurers can do the same. So if a patient rings them and says, I need to go and see someone, who do you recommend? Obviously, from an insurer's point of view, the practitioners who've kept everything up to date, who've got their most recent insurance on there, who've shown that they're continually doing their CPD, etc., those are more likely to be the ones that patient gets to be booked in with.
Yeah, definitely. The PPR is the main driver on that ICE solution that we've been talking about. So as that gains more and more traction, it's going to be a brilliant way of driving referrals into your private practice. As Desney said, it's not just insurers. It could be, findmeadoctor.com, etc. The various different companies that are doing that could integrate and drive more referrals that way. It's also going to save quite a lot of admin time as well, because when people book online, they'll be populating their information into the portal, as it were, or the website that's integrated. And then that information will automatically flow through onto your practice management system. So that, again, saves someone kind of typing all of that information into the system as well. Also, as more and more hospitals integrate with that system, if the appointment flows into that system, say ePractice as your practice management system, just going to randomly pick on a name, but say Spire Hospitals have integrated their hospital system as well, and your session or your treatment site is going to be within that Spire Hospital, that information could automatically flow straight onto the hospital system, so that the reception there know what patients are coming in without the need of kind of clinic lists being faxed over or emailed across, etc., to the reception. And I think, as certainly generations gone by, prefer to speak to someone, but I think the younger generations just coming through at the moment prefer to be able to book things like that online, certainly for new consultations, because generally people are looking at their diaries at 11 o'clock at night or so and seeing when they can fit things in. So security-wise, there's a huge amount going on in the security arena at the moment. Obviously, ourselves, yourselves, we've got medical, financial data, tech data, and that is top of the hit list for hackers. They're always looking for weaknesses in the system to utilise. There's been a few stories that have hit the news in recent times. So there was a clearinghouse out in America that had an incident recently. I think there was also a lab that a lot of the central London hospital use. I think the hospitals were kind of Guy's and Thomas, King's Hospital, etc. And one of them was a security weakness that hadn't been patched yet. So the hackers got in via that vulnerability. And the other one was a consultant clicking a link because it looked and had been spammed to look just like the clearinghouse had sent that out. So they followed the link, that installed a program, it was kind of a zombie program on the local machine that then gave the hackers access to the system, and then they can start trying to gather information via that terminal. So some of the key things to kind of think about when putting a practice management system in place, are that company audited? Do they have the necessary kind of qualifications, as if you will, like the ISO 27001, Cyber Essentials? Are they registered with the ICO, which is something you need to do as well when starting out in private practice, because it's you storing information on a computerized system, even if that computerized system is web-based and kind of fully backed up, etc., by the company you're using. 2FA as well. So we've released our 2FA system that we're going to be making mandatory shortly. Certainly having that second phase of security associated with your login credentials is key. Generally, the security industry are reporting that they think a lot of information has already been stolen by non-2FA systems, and essentially people are waiting for quantum computing to come about so that they can use that to crack the passwords on kind of Excel sheets and etc., which once quantum computing's there will take minutes or hours as opposed to months that it might take with current computer technology. And I think I think you found some stats that only 3% of businesses in the UK are actually registered and qualified for the Sabre Essentials scheme. So definitely something worth looking at. Like I say, ICO recognition for yourselves, and looking at that Cyber Essentials scheme as well is a good starting point.
And the other interesting stat was that if businesses had modern comprehensive cyber services in place, it's reckoned that approximately 97% of cyber attacks and data breaches would have been prevented. So that's really food for thought.
Yeah, especially as I think the UK is second only behind the USA for being targeted by the hackers as well.
Well, I suppose it's because of our populations and the sort of data that we've got.
Yeah, exactly. So just some further considerations. We've touched on some of this before, but when you're putting a system in place, it's always worth looking at the training that you'll receive on that system as well. Is it just it's installed and you're left to your own devices? Or like ourselves, do they run training? Is the training free of charge, or does it carry an extra cost? We also have our Healthcode Academy, which you can go on to at any point, book bite-sized training sessions. This is all free of charge. It's all one-on-one, conducted over Microsoft Teams. So it's specific to yourself rather than access to recordings or anything like that. And there's a multitude of kind of different sections to that as well. So that could be ePractice, kind of learning how to raise an invoice, or it could be help with your PPR, either getting registered in the first place or helping you get an existing profile updated in the background. What kind of customer services would you be receiving? So some companies it might be email only, others you can phone in or have live conversations. I'm pleased to say we've kind of gone omni-channel with that. So we've got chat bots, you could email in or have live discussions with people over the phone. That's all free of charge as well. So that's included in the subscription price for ePractice, or if it's kind of PPR, etc., that's all free of charge as well. What kind of response times would you get from a CS agent or customer services department from the company? Because really, when you've got a problem with the system or you're trying to learn how to do something, you really want to be able to pick up the phone, talk to someone immediately, or like I say, book a session a bit later on when it's convenient for you to get up and running. Security we've talked quite a lot about, but again, where are servers stored? Are they GDPR compliant? Are they in the UK? Whereabouts are the backup servers as well? Because it could be that you've got the initial server that's in the UK, but potentially a backup server is off outside the EU, etc. It's always worth asking those questions. It's quite common these days with us kind of all moving to web-based or SaaS solutions that you'll be able to access that data pretty much from anywhere with an internet connection. Kind of gone are the days where you get an on-premise installation of any of these types of software. And with that, the company should be able to tell you how they would go about recovering your data if they needed to from backups or clone servers as you go. Scalability. So Desney touched on this earlier with the users as well. So ePractice wise, as Desney said, you've got as many users included as you want to, because we want you all to be able to access the same data live as long as you've got authority to do so. Whereas some of the systems, they might charge you extra per user, potentially extra customer services charges as well, because there's more people using the system. So it's worth looking at not only what the system will cost you now. When you're starting out, you might only want 1 or 2 users, but you might grow exponentially and need kind of 10, 12 people to be able to access the system. What will it cost when you get to that stage if you're paying per user? The bright side of that is, because it is an ongoing business cost, you'll be able to offset some of the costs of having a system like this in place against your income from the year. So these systems are going to make it nice and easy for you to generate end-of-year reports, get those across to your accountant, which they'll either love or hate because you've kind of passed it across to them nice and easily. But at least they'll be able to offset some of those costs for you as well. So I think that's it from us. Desney, did you have anything else you wanted to add at this point? Or...
No, I don't think so. I think you've covered everything, unless people have some questions. There is a QR link there to our website, and I know Gwen will be sharing the slides. Further back, there was another QR code you might have seen that will take you to our Healthcode Academy pages. So we are here for you. We do try our best to help you out, answer your queries. There's also a whole load of help and support articles on the website. It's got its own section called Help and Support. So we do try our best to answer your questions before you have them, but equally we're trying very hard to be here for your feedback too. So we're for you.